Good afternoon, and welcome to our panel discussion for Life Interrupted, a documentary film featuring empowering stories of breast cancer survivors and told from a survivor's perspective. My name is Hiam Abdel-Badry, and I'm an advocacy specialist at the Arab Community Center for Economic and Social Services, also known as ACCESS, and I'll be your host for today's event. Before we get started, I'd like to cover a few housekeeping items. As you entered the Zoom platform, you were muted and you will continue to be muted throughout this event. To engage with our interactive panel, please use the Q&A feature located at the bottom of your toolbar. Throughout today's discussion, we will monitor questions and comments from Zoom's Q&A feature for our panelists to respond to. Our panelists will respond to as many questions as they can during our time together. But we regret not all questions may be answered due to time constraints. Today's program is available in English and in Arabic. To select the language of your choice, please navigate to your Zoom toolbar and click on the global icon. We have also closed captioning available in English, which you can actively use by using the CC icon on the toolbar. If you need assistance or have any technical issues, please contact our team through the Q&A feature. At the end of today's program, you will be directed to an online survey. We hope you will share your thoughts about the program with us to help us improve in the future. We will be recording a panel discussion and posting the recording on NNLM's YouTube channel. We will share a link to the recording to all participants that are registered for this event within the week. ACCESS is proud to be partnering with the Network of National Libraries of Medicine and filmmaker and breast cancer survivor, Paula Mozen, and the All of Us Research Program to offer a virtual film screening and today's panel discussion to increase awareness and understanding of the impact that breast cancer has on the Arab American community, and will continue to be a community that is underrepresented in biomedical research. To connect precision medicine and medical research with finding cures and treatments for breast cancer, and to increase awareness of health information resources provided by the National Library of Medicine and to the National Institute of Health and the All of Us Research Program. To tell you a little more about the All of Us Research Program, I would like to introduce Angie Gonzalez, who will spend a few minutes sharing the All of Us Research Program, a little more about it, and how it can help the MENA community. Welcome, Angie.
Thank you, Shems, and hi, everyone. My name is Angie Gonzalez, and I'm with the National Institutes of Health All of Us Research Program. I'd like to thank the network of the National Library of Medicine and the Arab Community Center for Economic and Social Services for having us in this exciting discussion about the Life Interrupted film, breast cancer, and the impact it has on all of us. During my presentation, I'll discuss a little bit about what DNA is and what researchers can learn from it, as well as what the All of Us Research Program is and how improving the future of health can start with you. The goal of All of Us is to really provide researchers with information that might help them understand more about why people get sick or stay healthy, and to advance precision medicine research. More on that in a moment. The program aims to engage a community of participants that reflects the diversity of America, including many people who haven't taken part in medical research before. To date, over 370,000 people have joined, and our goal is to get to 1 million or more. So what is precision medicine anyway? Precision medicine research considers the things that make everyone unique. It's also a fancy way of saying healthcare tailored to you as an individual. It focuses on the differences in our environment, like where you live, our lifestyle, like what you eat, and biology, your genes and family health history. And by studying these differences, researchers may find patterns, and this may improve health for everyone. DNA is the material that makes up genes. Genes can carry information that determine our traits like hair color, eye color, and risk of developing some diseases. Half your DNA comes from the biological mother, and the other half comes from your biological father. Your DNA is more than 99% the same as everyone else's. The tiny amount that's different is what makes each of us unique. You may have heard about a breast cancer gene or a baldness gene. These terms are not quite accurate. There aren't genes for specific diseases. Rather, changes in genes are sometimes linked to certain traits or diseases. Even one small DNA change in a gene can affect the processes in our bodies and can sometimes cause health problems. These changes can happen for a variety of reasons. Some happen by chance, and others are passed down through our families. So what can researchers learn from the information that the All of Us research program is gathering? Well, they'll be able to identify what makes people more likely to develop a disease, find out how environment, lifestyle, and genes can impact health, identify which treatments work best for different types of people, and create medications to treat or prevent common conditions such as chronic pain or diabetes, and also build better tools for detecting health conditions and encouraging healthy habits. Now let's chat about something that's important to all of us: data security and privacy. Your data and security are very important to us, and we'll protect your DNA information in the same way we protect your other information that you share with all of us. Your identifiable information, like your name and address, are stripped away from your samples, and you're assigned a unique code. Survey and all personal information are kept safe on an encrypted server with limited access, and participants have access to study information and personal data. And remember, all of us is voluntary. You're free to share as much or as little as you feel comfortable with, because all information is valuable. So now you're probably wondering, what's in it for your family and community? Well, it's simple. You'll contribute to research that may improve health for generations to come. By participating, you'll get a chance to learn about your own health, including personalized risk factors or exposures. You'll get the ability and choice to access your own data, including increasingly rich health records and ancestry trait information. And you'll get the opportunity to ensure that your community is included in the studies that lead to new understandings and new treatments. And this will help address health disparities and benefit future generations. By joining the program, you can leave a legacy for your children, your grandchildren, and future generations by supporting potential breakthroughs in areas such as cancer, diabetes, heart disease, dementia, depression, and chronic pain. Before I finalize my presentation, I want to invite everyone to get out their phones and open up your camera or QR code reader. The blue QR code will take you right to our website at joinallofus.org/connect, where you can learn more, subscribe to updates about the program, or enroll if you're ready to join today. We'll also type the website in the chat so you can easily copy and paste it into your browser. And if you currently seek care at any of our healthcare providers that belongs to our network, you can scan the black QR code and go directly to joinallofus.org. I'll also type the link in the chat where you can find the healthcare provider locations within our network. I'd like to thank you all for your time, and I hope you enjoyed learning about the All of Us research program. It is one of the largest active data collection efforts out there, and it needs you to help find answers to some of our biggest questions. So don't miss out on your chance to help change the future of health for all of us. Thank you, everyone, and back over to you, Shems.
Thank you so much, Angie. Now, we hope that you watched this powerful film and are ready to join an engaging discussion with our panel. It is an honor to be part of this amazing opportunity for so many women like myself and the women we support at ACCESS. We are daughters, we are mothers, sisters, wives, and friends. And so many of us don't know about the importance of being involved in biomedical research. And our job, my job, is to provide more information to learn and advocate for themselves, like the courageous woman in Life Interrupted. I was in awe of their drive to combat cancer head-on with all their might. In this film, we are introduced to three strong women from diverse backgrounds who advocated for themselves and partnered with their healthcare team during their biggest challenge, their health challenge of their lives. Life Interrupted tells the story of how personal and varied breast cancer journeys are, and this is true for every health condition. This is why precision medicine is key to the future of our healthcare, and why the All of Us research program is committed to building a database of diverse and individual health information that hopefully can impact the future decisions of many healthcare plans. During today's discussion, we will welcome the audience to ask questions, share experiences, and learn more about how research programs can support them. and support breakthroughs for breast cancer by advancing precision medicine. We hope you will walk away with a better understanding of how the program can spark positive change in research and why it's important for communities, especially underrepresented communities, in biomedical research to have an opportunity to contribute and to benefit from these health studies. Now, let's meet our amazing panelists. Our first panelist is our very own Madiha Tariq, the Deputy Director at ACCESS. Madiha oversees health promotion and disease prevention programs, including substance abuse and infectious disease prevention, maternal and infant health, and refugee health and the wellness program. She has published research on health insurance disparities among low-income people of color and mental health burden of Arab refugees, immigrants, and United States-born Arab Americans in Southeast Michigan. Welcome, Madiha. Would you like to tell us a little more about your background and your work at ACCESS?
Sure. So ACCESS is the largest Arab American nonprofit in the country. And, it was started by a group of volunteers to really work in the community and make sure that our new arrival community members were able to, utilize the services that were available to them, through social welfare and benefits. And, I've been with ACCESS for a decade now. And the reason why I wake up happy and come to work every day is because the work we do is truly fulfilling. My background is in public health, and most of us that work in public health, our goal is to bring health equity, and ACCESS truly, embodies that because we center the most vulnerable in our decision making. We make sure that the needs of the community are met by whatever means possible. I think one of the things that was a big learning experience for me working at ACCESS was, as a public health person, you always think about social determinants of health, right? You think about all these factors that are impediments to somebody seeking health. And for this community, for the Arab and Chaldean and the MENA community, Middle East, North Africa community, identity is also a social determinant of health. And this happens in two different ways. One is because MENA communities are not considered a minority. So oftentimes they're left out of conversations when resources are being distributed, and we don't have any data. The only way we can collect data is on a community level, because on the national level, there is no data. And that impacts the services that are provided to this community. And then the second piece is, the political impact of identity, being those that are identified from the MENA community are identified in a very negative context. And that also impacts their ability to utilize services because they feel discriminated against. So it's this, social and political determinants of health that have really helped define, how I do my work every day, to make sure that health is decentralized, health is provided from the hands of the people that our community trusts, and that ACCESS remains a welcoming space for everyone and a safe haven for those most vulnerable.
Thank you. Thank you so much, Madiha. Our next panelist is Hiam Abdel-Salam, who is a second-year genetic counseling graduate student in the University of Michigan's genetic counseling program. During her graduate training, she developed a study seeking to characterize communication patterns about cancer and cancer risk in Arab American communities. Hiam, thank you so much for joining us today. Could you tell me a little more about your research and what your plans are following graduation?
Yeah, absolutely. So my research that I'm doing at the University of Michigan is really hoping to look at what communication about cancer and cancer risk really looks like in the Arab American community. And the reason that I'm really interested in addressing this question is to really help us to think about how can we improve access to cancer genetic services for Arab Americans. The reason that this access is really important can be seen in this figure that I hope to show very quickly. So this process of getting something like cancer genetic testing in a cancer genetics clinic starts with information about your personal history of cancer and your family history of cancer, along with other pieces of information as well. And depending on this information, this can lead you to getting a referral to seeing someone in cancer genetics, or maybe your doctor may go ahead and order genetic testing for you depending on this information. And the results can be really powerful in terms of us thinking about testing other family members who may also be at risk. It kind of impacts on your treatment if you already have a cancer diagnosis. And it can also modify your screening. So how many times should you be getting a mammogram? How many times should you be getting a colonoscopy? However, if there's anything impacting your ability to have this information, then this can really deny you the ability to do all these things like testing other family members, treatment options, and cancer screening. And I also don't want to ignore some of the factors that Madiha mentioned in terms of not just thinking about communication, but also other social factors and systemic issues that might impact your ability to get access to these services as well. And so to answer these questions, I did focus groups, and many of these individuals were young adults in the community who really wanted to have these conversations around talking about cancer and cancer risk in their family and in their community in general. And I just wanted to share some quotes that these young individuals provided in these focus groups. So when talking about their attitudes around cancer, cancer risk, and genetic testing, many had a strong understanding about environment and genetics playing a role in cancer, but many agreed that there was some kind of shame or stigma around cancer in their community, and that cancer was a taboo topic. So sometimes the word cancer is not used and might say something like al-marad, a more vague term versus cancer. They also mentioned that it was difficult to talk about cancer risk because it just wasn't a very concrete or understandable concept. So what does it mean that I have increased risk for cancer? I either have cancer or I don't have cancer. And so that led to many people feeling like genetic testing was just very unnecessary for them and just brings about additional worry and stress that they don't need. In terms of thinking about communication patterns in their family and in their community about cancer and cancer risk, many expressed that communication was limited and felt like things like generation played a role. So younger individuals want to have these conversations, but maybe older individuals have other reasons for not wanting to share about this. And many of them felt like their parents wanted to protect them from this information. They didn't want to bring about any additional worry to their children, and so weren't talking about cancer or cancer risk. In terms of any cultural or social factors, many felt like mistrust of the healthcare system. So if they've had prior negative experiences with any providers in the US, really impacted their willingness to talk about cancer, cancer treatment, or trusting genetic testing results. We also asked about family values. So specifically, if they felt like marriageability, the ability for their child to find a partner or for them to find a partner was important. Interestingly, these individuals, these younger individuals felt like it wasn't as important for them, but felt like maybe their parents would be more concerned about if a potential partner's family member had a cancer diagnosis. This would be something important to think about. And then finally, we felt it was important to ask, what is it that healthcare providers, the doctors that you're seeing, any genetic counselors that you're seeing, what should they do? What can be most helpful for you to have these conversations? And many felt like education was the most important thing. Understanding what are the causes of cancer? What does it mean to be at increased risk for cancer? What do these results specifically mean? They felt like it was very important. And also really making sure that these providers, as much as possible, are individuals from the community. So preferably ADA physicians, ADA genetic counselors are having these conversations because they're able to understand these cultural and social values that the community has, and really making sure that it's accessible as possible. So one example was many felt like any educational material should all be in Arabic to make as many people in the community have access to this information as possible. And so I really hope that kind of some of these quotes shed light on some of these views and how individuals in the community are thinking about this topic moving forward.
Thank you so much, Hiam, for sharing, and thank you for the impactful work that you're doing. And last but not least, we have Paula Mozen, Director of Life Interrupted. She is an award-winning documentary filmmaker, educator, and PBS consultant who is a two-time breast cancer thriver. Paula, Life Interrupted is a phenomenal, honest journey about breast cancer and the courageous women who fight it each day. Could you please take a few minutes to share a little bit more about the documentary with our viewers?
Sure, and thank you for having me here. It's an honor and a pleasure to be with you and the rest of the panel. So I was a filmmaker way before being a breast cancer survivor, and so as I went through the process of being diagnosed and then being treated for breast cancer, the idea of making a film, started to cross my mind. And as I was exploring some of the issues, I came across two things that I thought were very important and that I would follow as I continued on with the research for the film. One was one size does not fit all. Breast cancer does not discriminate. It can be found anywhere in the world and among, all classes, all races, religions of people. At the same time, access to healthcare can and does discriminate, as both of the panelists before me have very eloquently mentioned. And at the same time, individual circumstances are unique, but hearing stories from women that have gone before us can be invaluable and help us to navigate the treatments. We talked earlier about the importance of storytelling, and I think no matter what culture you come from, we can all relate to a story and kind of dive into an issue once we can, get a grasp of who that person is and where they're coming from. So I knew that I wanted to include the process of diagnosis, treatment, and what happens after treatment, or what we call beyond, and also a little bit of medical information and, of course, the psychological impacts. So that's a lot of stuff, and that seemed important to put out. And I'm going to kind of go over a few reasons why I thought it was important to cover so many aspects in so many different ways. Number one, I wanted to put a face to the statistics. We all kind of hear these numbers and, sometimes can forget that there's real people with real lives behind them. We know that 1 in 8 women in the United States will be diagnosed with breast cancer in her lifetime. That comes out to be about 325,000 in 2020. So my film shows 3 people and then some other characters, and to just realize that there are so many of us out there, dealing with this in a constant, period of time. It was important for me to validate the survivors' experiences. In the United States, particularly, we kind of have this crazy thing about pink ribbons and breast cancer and trying to make it, they sexualize the disease, and the media can kind of take it all over the place. And I wanted to reclaim those stories and to show that, treatments, we're lucky to get treatments, but treatments can be very rough. Including amputating body parts. How many other diseases, do that sort of thing to treat people, and taking toxic chemicals, into our systems like chemo and the chemotherapy treatments. I wanted to empower patients to be proactive in their own treatments, to advocate for themselves, to do the best they can by and for themselves, at the time of treatments, that it's important. Women are often the center of their families, and they're so used to being advocates for their children, for their partners, for their parents. And this is one time where it's very important to be an advocate for yourself. A lot of women are the center of their families, and their families need them to advocate for themselves. To help providers treat the patient, not the disease. I've spoken to so many providers, and people have seen the film, and they're used to seeing so many people, and it becomes again this numbers game, and to realize that person sitting in front of you is a whole person, with a background, with a family, with a life. And finally, to just give family members, friends, advocates a sense of what being diagnosed with breast cancer and living with breast cancer is truly like. And so those were kind of the underlying factors that kept me going and motivated me to do the film and to finish the film.
Thank you so much, Paula. Thank you for sharing your story and the story of so many women. I'm so elated to have this conversation. It's definitely a conversation that's needed in our community and communities across the country and the world. So I'm going to start with a few questions, but I encourage our audience to submit their questions, comments, and stories in the Q&A feature. And again, the majority of our questions that we already have, our panelists have touched on a bit, but I'd love us to expand on that a little bit more. My first question goes to Madiha. A vital theme during the film was access to healthcare. Can you provide us with a little more information about around access to healthcare for Arab Americans, and what are some trends that you see that are consistent within the community?
So the Arab American community has had a long journey with access to care. I think a lot of people in this country have had that journey. About over now 7 years, it's been 8 years this year that we opened up our first open enrollment, right? With the Affordable Care Act, pre-existing conditions were removed and more people were able to enroll into affordable health coverage. As we know, from day one, before that even happened, there was so much political pushback to providing healthcare. And we know in this country as a whole, we struggle every single day for healthcare to be considered a right, not just a luxury. So that's one piece of it. But specifically with the Arab American community, it was a journey, because when we first began our open enrollment and enrolling people into health coverage, there was a lot of issues of trust. People are coming from spaces where they did not trust giving their information to the government. So we as an agency had to work hard to build that trust. And, in the course of 4 years, we enrolled 40,000 plus people in our community. We were recognized nationally for how many people, started, actually applying for, health coverage through the marketplace. And then with Medicaid opening and us being, really there to advocate and bringing the stories of people in the community who have benefited from Medicaid to light was an extremely important journey for us. But that didn't last long. As you all know, in 2016, things started changing in this country again, and the pushback against access to health was immense. And since then, we've had many policies that have come in the way of people really being confident that they even deserve to have health coverage. I mean, it's not even about how, it's about whether they think, they should be one of the lucky ones who get health coverage. When a few years ago, when this whole conversation started around public charge is a policy that basically says that if you are being sponsored to come to the United States, like through the immigration process, they will look at how much benefits you've utilized from the United States. And technically, there's a lot of exceptions to this, but because there was so much conversation around public charge, people who even fall in the exceptions still were afraid to take advantage of services. We actually had a pregnant woman from our community who was utilizing the Women, Infant, and Children program come in and insist that she had to drop. She was 7 months pregnant at the time, I believe, that she had to drop her health coverage because her husband's immigration status was just getting finalized, and she wanted him to be here in the US for the birth of their child. So for a 7-month pregnant woman to make a choice between her health and her family, that all comes from negative political policies that have impacted specifically our community. So this is another, kind of thing that I was talking about with political determinants of health that very much exists for our community. The other piece is also, discrimination. We have done research, and I know Hiam and her team have been part of some of this work, but we have done research that clearly links, appearance and language and factors that specifically link somebody to a culture to utilization of care. So, and it even, translates into eligibility, like how people think whether they're eligible for something. So we had a client that came in for Medicaid, they wanted to enroll in Medicaid, and they asked them about, in the demographics question, they said, okay, so what is your race and ethnicity? And they said, can you please put me as white because I want to get my Medicaid approved quickly. This is a reality in our community. So, health access is a long journey. And then we're even, getting that insurance card is only a beginning of the journey. After that, we have to talk about health literacy, helping people navigate from coverage to care. And those things come after. And those are whole new journeys that, our organizations, community-based organizations are deeply involved in.
Thank you for that, Madiha. And this is the perfect segue to Paula. In the film, Debbie decided early that the first doctor that she visited with would not be the only doctor she saw for treatment options. She advocated for interviewing doctors, asking them how they would treat her and how willing they were to work with her. Why is this important for patients to do? I also have a second part to this question, but I'll let you answer the first part.
Okay, so that's a great question. And that's one of my favorite parts about Debbie's story, because I think she's modeling behavior that's so important to patients. And so you want to make sure that you find, there's a whole team that you're working with. So you want to fit with your oncologist, you want to fit with your surgeon, you want to fit with your, if you have a nurse practitioner, all of the people. And because basically, as I said before, I mean, somebody's in a lot of cases going to be operating on you, is going to be deciding what kind of chemicals they're going to put in your body. You're incredibly vulnerable if you're going to have breasts cut off or parts of breasts cut off. This is a big deal. And so you want to be able to resonate with that person. I think number one, you want them to see you and you want them to respect you, not to see you as just a number, but as a person. So I think that, as I said earlier, I think particularly women are, I know certainly for myself, it's much easier for me to advocate for other people than for myself. And I think it's just and that's why it's good to have a person, an advocate for you, but it's so important for you to really go to the nth degree to feel as comfortable as you can with what's going on. And I always tell people, you've got to keep asking questions until you understand the answers. This is not easy stuff. And then throw in if there's a language barrier or, or you're concerned that, your immigration status is not, it's not up to snuff or that people are going to be judging you by that. I mean, I totally acknowledge with all of this, the white privilege that I am able to have. And, you know, I know how difficult it is to go through breast cancer with that white privilege and to then add on some of these other layers. But regardless, you do the best that you can so that you're going to get the best treatment and hopefully the best outcome, you know, for your situation.
Thank you for that, Paula. And I know it's true. A lot of times with many women, we're really good at advocating for others, but when it comes to ourselves, we like to take a back seat. In this decision, I was inspired by Debbie because of the way that she approached it. She didn't have the answers at times, maybe not even the questions, but she pushed, right? And that's something in an advocate that I love to see. This is something that I feel like may relate a lot to our communities because of the misinformation around breast cancer. And I know Hiam may be able to touch on this based on her research as well. But Paula, how did you feel that the way that Debbie approached her medical journey, how do you think that affected her fertility options, or how did she come about that?
Okay, so let me just back up a little bit. Those of you who've seen the movie, you see that Debbie comes from an incredibly strong family. She had a very supportive and present husband and parents that, you know, are very loving and were very supportive. Her father went to some of her appointments with her as well. And so I think that the fact that her husband, you know, was so present with her, and we had this discussion about how, as a survivor, you know, the first time you're told you've got cancer, you kind of go into, a lot of us go into the zone, and it's just like, you know, and you think you're going to die, and you just, I mean, it feels like a bomb's been dropped on you. And so you kind of have to get over that, and then you have to learn all this information really quickly. And so what I think was really smart about Debbie, and also just how she works with her husband, is that he was there with her and was able to, he would attend the appointments and he would help take notes, so that, because we talked about this, I can't remember if it was in the movie, but we talked about it behind the scenes, that, you know, as a patient, sometimes you miss some of this stuff, or you hear what you want to hear. So it's great to have somebody else there who's got your back, who can help hear the information. My dad did that with me, you know, on my journey. And so I think by, you know, having the support of her husband, and then, and Debbie's, I think, a very confident person. You know, I think it takes a lot of confidence to become an airline, you know, travel person, where you're dealing with the public all the time, and you're kind of, you know, you put yourself out there. And so Debbie's like that. And I think it allowed her to go and interview people and really trust her instincts. And because of all that, she was young at the time and wanted to have children. You know, she had wanted to, she comes from a wonderful family. She wanted to have her own family. And so I think that having that positive experience of kind of finding the right team then allowed her to, again, you know, reach out, go beyond her comfort zone, find out about, you know, cryogenics, find out about, you know, the information that she needed so that she could go ahead, and she had her eggs taken out and go through that process. In the end, she didn't, you know, they had the baby the old-fashioned way, but, you know, she set herself up so she could have what she wanted. Does
Definitely.
that answer?
Yes, it does. And I mean, you know, when you said interviewed, a lot of times when people look at their doctors, it's, oh, they're telling me what I need. But with Debbie, we saw, you know, she was going in and she knew, she was asking the questions, and she was interviewing them. And I like that. I like that terminology. Hiam, genetic testing can be instrumental in better understanding one's health. Many of the clients we serve at ACCESS are first or second generation Arab Americans who may not be able to complete a family tree, as we saw in the film, or know their full genetic history. What would you recommend to those people who do not have their full genetic history on hand?
Yeah, This is a very good question, and a situation that's not particularly uncommon. There are many patients who come in to see a genetic counselor and have very little or don't have all the information about their family history. It's just the difference of what's the reason why you don't know that information. I would say two things for that. One, it's important to just have as much information as you can. I'm also coming at this from the voice of a future clinician, and I've rotated and I've talked to patients myself, and we really do work with whatever you're able to give. And sometimes even just knowing one affected family member can be the tipping point for you to be qualified for genetic testing. So for an example, I've seen a lot of patients where they themselves have a very young breast cancer diagnosis, or they have a mom or they have a daughter who has a very young breast cancer diagnosis. That automatically qualifies you for getting covered for genetic testing because of specific criteria that we use. So I would highly recommend just providing as much information as you can. I also just wanted to highlight that family history information and personal cancer history information is just one piece for how we think about cancer risk. There are a lot of other pieces of information that we use as well. So things like, how old were you when you had your first child? How many children have you had? How old were you when you underwent menopause? Any prior surgeries that you've had, such as, have you had your ovaries removed? Have you ever had a hysterectomy? These are all factors that impact hormones that are going through your body and also impact your breast cancer risk. And this is also information that is likely more readily available to you that you can provide your primary care physician or a genetic counselor that we also use to inform your breast cancer risk as well. So even if your family history is limited, we can still use this additional information to help us inform your risk further, which I think is really, really important, because there are patients out there who have very little information about their family history, maybe only know 1, 2, or no family members. And we're really trying to work hard, especially in the genetic counseling space, to consider those barriers.
What do you consider as young for breast cancer?
That's a great question. So typically, younger than the age of 45 will automatically qualify you, but there are a lot of policies that are opening that up more. So for example, there are things like, if you're older than 45, but you have additional 2nd or 3rd degree relatives who have a cancer diagnosis, then that meets criteria for you to get genetic testing as well. And then as well, there are certain organizations that have really pushed for genetic testing for breast cancer patients. So the American, I believe the Academy of Breast Surgeons, they believe that any patient affected with breast cancer should be getting BRCA1, BRCA2 testing already. There's kind of different opinions on that, just given the number of genetic counselors in the clinic and who's able to see all these patients. But the eligibility is really widening up in terms of who is able to be qualified for genetic testing.
Thank you so much for sharing that. I have a question from the audience that I believe relates to this, and to having that conversation around genetics, but also having this difficult conversation with family, especially since you have already pointed out, I'm Iraqi American, and in our community, when we say al-marad, we know we're referring to cancer. And I've had family friends get diagnosed, but the way that we rally as a community around that is not the same way we rally around other diagnoses. The question from the audience is, how can I talk to my older conservative relatives about breast cancer without making it uncomfortable? It's taboo to mention, but it's important to do self-checks and get screenings.
Yeah, absolutely.
Is open to the audience as a whole too, because I know this is definitely a conversation that can be had anywhere.
Yeah. This is a very good question. And it's one of the main reasons that I've been really interested in this topic of what is it really that we're feeling uncomfortable about. And I think I would say two things. One, really emphasizing as a younger individual why you're having this conversation. So I would really focus on the value of screening, the value on prevention as like one tool to really open someone up versus it just being for the sake of curiosity. I think that's one of the main difficulties about this, especially when we're thinking about like genetic testing. Some individuals feel like we're just doing this for more information. Like it's like 23andMe testing or ancestry.com. You're just kind of doing this for fun to gain for information. But it's really about the next steps after you're doing this test, and the next steps are these conversations. I'm doing this because I want to know if I should be getting increased screening, if I'm qualified for increased mammograms. And as well, something that I'm learning about, and this is coming from a much more personal space, because I have family members who are also affected with breast cancer and are very hesitant to have these conversations with me. There are very legitimate reasons why they are nervous to have these conversations. They likely maybe have not had these conversations before, or don't want to increase any stress or worry, or really want to protect younger generations from any unnecessary stress, or maybe are scared this information might leak out outside of the nuclear family. And I think going back to really thinking about family values. So autobs are very known to really focus on the family and protecting the family. And it can be hard to think about any topic or conversation that might jeopardize that if other individuals find out this information. So I think for me, it's understanding why are these conversations are important, but also understanding why do these barriers exist, and why are these individuals maybe having a hard time, and kind of meeting people where they are at the same time.
I would also say that, tell them to call ACCESS. Honestly, we have the reason why our program is so unique is because it's powered by survivors, Arab American women that, had the same journeys as some of the people that, you featured in your documentary, Paula. But the difference is, unlike Debbie, some of these women don't have the support network, and they didn't have the language support. They don't understand the health system. Half of the time, they're only getting about 20% of what the doctor is saying.
Right.
So what we did is we created that village for the women that come through ACCESS. So a lot of our team members, they're survivors. They've been through the process. We have a survivors circle, that connects on a regular basis, and they help us they help inform academics on what kind of research there should be out there. So social mobilization is a really powerful tool, and it really helps fight the stigma in the right way.
Do you have people, advocates that would go with a woman to see the doctor?
Absolutely.
Oh, that's great.
Actually, Madiha, can I have you share with our audience how ACCESS has done it that's different than other clinicians, maybe? Sure.
So, screening for preventative screening in general, rates really low in the MENA community. And this is especially true for breast and cervical cancer because of issues of shame, stigma, all of these things. So we started doing a lot of community outreach to make sure that, we're going to community centers, faith-based institutions everywhere to talk about people coming to get screened. And there was this one story several years ago when we first began this program, that this woman came in and she got an exam with us, and she ended up having a lump. And then when we contacted her for follow-up, we have navigators that work with the patient that will, accompany you to your appointment, arrange transportation, check in on you on a regular basis, talk to you about nutrition.
Right.
We're offering this array of services to her. And she said, please don't call me. Like, I don't want anyone to find out that I have this disease, because I have 2 daughters that are not married. And I know Hiam mentioned, that talking about this with generationally, some of this hopefully is changing. But the point of the matter is that there's still a lot of people who had this stigma. So we needed to make sure that our services were provided in a manner that was comfortable to the community. So our clinic now has a back entrance and a waiting room in the back of the building. So women that are coming in, they don't have to wait with everybody else in the common waiting room. They can actually come in their own entrance and then do their exam and their follow-up care. And we do a lot of home visiting. I'm a big believer in decentralizing health. I mean, if we can learn anything from other countries, is that if you want to reach vulnerable people, you have to go to different, communities and recruit from those communities, create health workers that actually go and educate people and people trust them. So we have this big network, big sisterhood, and now brotherhood, because we work on, a lot of cancer issues that affect men too. And that's how we are able to, reach really vulnerable communities.
Thank you, Madiha. Honestly, I'm sad to say this conversation will end in 10 minutes. I just want to keep going. But I do have a question from the audience that I think Madiha, you've touched on, Paula, you've touched on, is what support systems are there if someone doesn't have family members like the ones in the documentary? We saw a lot of our folks in the documentary had a male figure from their life, a strong male figure that was there to support them. I saw that woman in the documentary who went to support groups, but they didn't feel like it was really for them due to age differences. Would you recommend, are there social media groups? What else is there for people outside of those circles?
Well, I'll try and answer this quickly in case anyone else wants to jump in. But yes, I think that's one thing that social media has been great for. There's some amazing Facebook groups, Instagram groups. I have a list of resources that include some of these, groups for women of color and groups for younger women and older women. I think it's important to look for your tribe, whatever that is, and find the people. And I know that ACCESS has these amazing resources that you've been describing. So on my website, which is lifeinterruptedfilm.com, there's things like that. Maybe we can put something up in the chat. And also, we're working on a resource list that we're going to be putting out soon. But for me, I think, that's been super, super helpful. I don't want to take up the time, but I don't know if you guys want to add anything else to that.
Just call ACCESS. Our team, they go out of the way. I think they treat every client like family member. And I think that's because they have lived experience. So you will not be disappointed. Call ACCESS, call our team, and they will help you find the resources that you need. Whether you're insured or uninsured, by the way, because we make sure that nobody is turned away.
Thank you so much, Madiha. Thank you, Paula, for answering that. So I have one last question, and then I'll leave it up to y'all to wrap up and leave us with some anything you'd like with us. So we've seen marginalized communities disproportionately affected by COVID, more specifically within the Arab American community due to several factors around education, healthcare, and community needs. Can you provide more context around access to preventative care and how it's been affected by COVID?
I mean, I can just give you, I think I've spoken about this a little bit, but, a lot of the diagnoses, a lot of the people that are coming in right now to get screenings, they end up being in later stages of cancer. And that's because due to the pandemic, many people did not go in for screenings because of the COVID safety concerns. On top of it, the shutdown was also very hard on communities that are low resourced because they did not have, less access to transportation. A lot of nonprofits and other organizations that help out shut down because of, lack of resources. So a lot of people were left very, very isolated. And, what we have seen a lot of people, as I said, in later stages, but I don't want to, just end with that. I want to share something hopeful as well. Ever since the pandemic began, we have been on the forefront in being part of the pandemic response. And one of the things that we did uniquely, so we did drive-through testing at ACCESS, but at that drive-through testing, we did a comprehensive need assessment and for the clients that were coming in to get tested. And there's this one story that really, is so impactful. One of our team members, Ghada, was doing intakes at the testing site. And this lady ended up coming in to get tested, but Ghada was talking to her, what else do you need? And she said, I think I have some problem with my breast, but my immigration status is not like, I don't know if I'm going to be able to get, services. And because Ghada was her intake person, she ended up coming into the office the next day, and she got an exam, and she ended up getting diagnosed, but early stage. And then now she's being offered services. So, we are trying, a lot of people are doing creative things to try to get people to come in early, but the fear is real, I mean, COVID is a scary thing. And we are all women, and women put their long-term preventative care in the back burner. How many of you went to your physical this year, just your annual physical, Actually, don't answer that, because then I'm going to get really sad. But it's true. That's how we are.
Thank you so much, Madiha. Paula and Hiam, are there any last words you would like to share with us?
Yeah, I just wanted to add, actually, I think something very interesting about this pandemic from a healthcare setting is the increase in telehealth and in virtual visits has actually been one thing that we're seeing has actually been improving access in some way, particularly when we're thinking about patients who maybe don't live near a tertiary care center where there might be preventative services. So having that ability to video chat or just do a phone call with a patient has gone a long way in us expanding the patients that we've been able to reach, which I think has been one of the interesting silver linings of COVID-19. And I also wanted to tie it back to something that Madiha mentioned earlier about how do we make sure that our services is being tailored to the experiences of our patient. And I'm also thinking about it from a privacy concern, where maybe something like a virtual appointment might help with that privacy concern. You're not a patient who has to sit at a lobby waiting to be called in by your physician. You can be at the privacy of your home and talk to your physician about whatever conversation that you need to have. So I really do value the option of video or virtual visits as something that can really address some of these barriers that we've been discussing today.
Thank you, Hiam. Paula?
I want to just say that you don't, we talked about, even if you don't know the questions, or, keep asking questions. You're not, it's very confusing, and there's a lot of information you need to take in before you make decisions. So I say keep asking questions until you understand the answers. And even though you feel like you want to move quickly, and I'm talking about when you're diagnosed with cancer, take the time you need to make the best decisions. That it's yes, you want to move forward with it, but you don't have to do it in a nanosecond. And that the support thing is so important. Most of us, I know myself and probably everybody I interviewed, felt like we were the only ones, even though we know intellectually we're not. You still feel like that. And so it's so important to reach out and to get help and to get advocacy, through all of this, because it is a big deal. And there's wonderful people like, the people on this panel, and there are wonderful people out there that do want to help you. So don't be afraid to, to reach out for help. And it really makes your journey so much easier when you've got some people on your side.
Thank you, ladies, so much for taking the time to talk to us and talk to our audience. Honestly, at points, I was just left in awe and just smiling, because seeing this empowerment and this advocacy is very inspiring. Thank you, Paula. Thank you so much for sharing your story and the story of others, and to get the message across and taking the time to meet with us and meet with others across the country and the world. I heard that there was a showing in Africa, so I'm assuming all over. But thank you for taking that message far. Madiha, thank you so much for taking the time to meet with us and share the work that's been done at ACCESS. And Hiam, wow, the research, the genetics, I definitely think is a conversation that needs to be had in our communities. And you're doing the work, and I'm very proud to hear from you, and I can't wait to see where it goes from here. To our audience, thank you so much for joining us today. We want to thank you for attending our Life Interrupted panel discussion. This program was made possible in partnership with the National Library of Medicine, the network of the National Library of Medicine, and NIH All of Us Research Program. Before you go, we will appreciate your thoughts on this program. A link to our 2-minute survey will be in the chat. Your responses will help us continually improve our programming. We hope you enjoy the rest of your day. Thank you.